Hi, my name is Dr. Robert Johnson. I am a family physician with Bon Secours Family Medicine Center. I chose to go into medicine at a very young age, a little different than most people who sort of figured out in high school or college. Um, Almost as early as I can remember, that's all I ever wanted to do. I can remember my dad asking me a question once, "Bobby, what do you want to be when you grow up?" And I said, "I want to be a policeman." And then he actually looked at me seriously and said, "But what do you think God wants you to do?" And I looked right at him and I said, "God wants me to be a doctor." And from that point forward, that's all I ever wanted to do. The reason I chose family medicine as a specialty is because of the variety that it offers. However, I think all of us as physicians have special areas that we like. For me, I mostly enjoy the pediatric end of things. I enjoy women's health care. And then minor surgical procedures are something that I really have always enjoyed. I actually, when I went into medicine, originally I thought I wanted to be a surgeon, but I quickly realized that I desired that long-term connection with patients. But that surgery part of me is still there, and I really enjoy that. Patients, I think, really want to be listened to, almost more than anything. And so if I have a patient that tells me, I appreciate that you listened to what I had to say today, and that you heard what I was saying. You didn't just, treat the condition or get a diagnosis and shoot me out the door, but I really appreciate that you heard me. To me, that makes me feel like I did my job, that I fulfilled a need. And that's really what I'm after. So I appreciate that when patients tell me that, because that helps me know that I did the right thing. Bon Secours St. Francis Medical Group is very unique in my experience, in that it is a faith-based organization that actually practices what it states in its mission purpose statement. And I have, in my private practice before I came here, I was fortunate enough to be part of a group of faith-based physicians and mid-levels, and I felt that was going to be hard to replicate. So when I went to look for a job in Greenville, that's the first thing I wanted to find is to see if there was any organizations out there that were faith-based, and Bon Secours meets that not only in name, but I've been extremely impressed in the short time that I've been associated with them, that they really believe what their mission is, and they love their patients, and they care about the spiritual aspects of their patients.